Okay, welcome to our weekly resident meeting where we discuss difficult cases and we clear up some problems that the residents are having about the pulse or anything else having to do with Chinese medicine. This is one of our residents here, from Nim. So Nim, what's your question?
How do you deal with somebody whose pulse is deep and weak? What is the best herbal strategy?
Okay. What's one of the most difficult things to do, believe it or not, in Chinese pulse diagnosis, is to be able to distinguish between a weak pulse and a strong, stagnant pulse. You can get confused. A weak pulse will always be thin, like the edge of a piece of paper, and when you push on it, it just goes away. It can be a little bit wider too. If it's a little wider but weak and you push on it and goes away. The wider weak pulse is just straight qi deficiency. The thinner ones are qi and blood deficiency. And if the person's hand is very cold or their feet are very cold, and if the pulse is extremely thin, that's yang deficiency. Okay, so what Nim is asked is if the pulse is deep and it feels weak down there, then what do you do? Well, let's just go into it. First of all, if the pulse is really deep, it's probably not weak. You're dealing mostly with damp stagnation in the body combined with blood stasis. So they have a blood stasis problem and they have a damp retention problem. And because the pulse is not pounding, otherwise Nim would never think it was weak, it's pounding, then it's damp, heat, blood stasis. If it's just deep and somewhat amorphic, it feels somewhat scattered, or the pulse is kind of hard to read down there, it's blood stasis with dampness. If the hands are cold and so forth, it could be damp cold. So what about, could it be that the pulse is deep and it's weak? Yeah, that could happen. And what that will feel like is the pulse will be deep and it will feel thin, and when you push on it, it goes away. And you'll find this mostly in the heart position, in the left sun. You can feel a little weak pulse down deep, and then the pulse disappears. This is congestive heart failure in the making. These are weak hearts. And very often, these could be overweight people where the heart has become exhausted trying to pump blood through a bunch of squashed blood vessels because of the adipose tissue. For every extra 10 pounds that a person has on their frame, especially through the middle jowl, every 10 pounds squashes the longitudinal and organ vessels, squashes them in half. Mayo Clinic figured that out a few years ago. So if somebody is 100 pounds overweight, they could literally have an 80% reduction of blood flow into all the major organs of the abdomen. This causes a lot of trouble. And so here you have a pump called the heart trying to push blood through these very narrow passageways. Over time, this will exhaust the heart, and the heart will be weak. Okay? These patients need a tonic for the heart plus blood movers for the blood stasis. And what I've discovered clinically is that the formula has to be mostly blood movers, more than 50%. The rest of it can be a tonic for the heart. The best one I've found for the deep pulses is Fong Ji Huang Qi Tong, because that formula is not just Huang Qi based to increase their energy, but it will get rid of dampness in the body. Huang Qi is a very good diuretic combined with Fong Ji. Works very well. So you can use that, but you have to make sure that pulse is indeed weak. If you screwed up and the patient comes back a few days later and you feel the pulse, and that pulse in the left sun feels really muddy now, strong and kind of muddy, then they really had a blood stasis problem and you tonified something that shouldn't have been tonified. So these are just typical mistakes that are made clinically. But what you'll find is that true qi deficiency or true anemia or yang deficiency are not that common on the American audiences. Americans are usually too hot and too clogged up. They've eaten all the wrong food, they're overweight, they're clogged up. You don't really need to tonify them, you need to detoxify them. Okay? Thank you very much.